I hope you're comfortable and you've got a nice cup of tea or something stronger, because you might well need it if you listen to me for the next half an hour, 45 minutes, an hour. So I apologize in advance. So I'm delighted to be asked. Actually, I like speaking to like-minded people who are interested in the same things that I am. So always delighted to be able to speak to societies and beyond. I've been delighted to be part of the Suffolk Horse Society as well for the last few months. It's fascinating, it's interesting. I'm meeting again people I've known for many years, and it's a lovely thing to be a part of. So I'm glad we're all pulling in the same direction. But tonight I've been asked to address foalings, and I've put the title "Foalings Don't Panic." Sadly, foalings fill some people with dread, which is why I've put this lovely photograph up to start with, because that's what we're after. I know it's not a Suffolk, but it's a mare, it's a foal. She, interestingly enough, foaled in the field, hence the lovely green stuff around it, rather than the sanitized foaling boxes we're so often used to. But that's what we're after, that lovely, peaceful situation where mum and baby are looking at each other. There's not a human person interfering. That's ideal. But I want to take you through the foaling process, hopefully from the start to the end. I want, at the end of the talk, for you to be familiar about what is normal. I want you, for anybody who foals a lot, I want to be able to give you a few ideas on what you can do should something go wrong. And for those of you who haven't foaled a mare before, I want to take some of the mystery away and some of the fear away, so that when you do foal your first mare, you say, oh, do you know, yeah, I'm expecting that, or oh, it's fine, I'm experienced about it. To start with though, oh, there we go. To start with, I do just want to point out that the nature of this talk is that there will be some blood, there will be some injured animals, there will be some things that some people might find distressing. So if you are wanting to avoid it, I'll try and give you a heads up, but you might want to go and do something else for an hour in the meantime. So there's the little warning. So here we go. Foaling is absolutely essential if we are to preserve the breeds. There's no way you can avoid it. It's an amazing situation. You start with one overly large creature and you end up with two, one a little thinner than the other one before. That's foaling in a nutshell. But the fear always is, are we going to encounter a problem? Are we going to have a bad foaling experience? And that's called a dystocia, where there is a problem during foaling that you have to sort out as a supervising human in the area. But from the outset, I want to tell you that they are relatively uncommon. If you foal 100 mares, you will only encounter a problem 10 times. And of those 10 times, one of them will be an utter disaster, but the other 9, you can do something tremendous and make it right. So yes, we live in the fear of foalings going wrong. In reality, it is not a given. But equally, we have to understand that the pregnant animal, the mare after foaling, the foal that we've been presented with are absolutely specific in their needs. And that's very different to your gelding that's in a field or to any other horses you have. And I think if we're going to do this properly, we need to know exactly what is normal for each animal that we're dealing with. If we can identify the things that are abnormal, we can recognize them promptly and rectify them quickly. And yes, I'm on, yeah. No, I'm lecturing. Could you close the, okay. Excuse me. We've got a birthday on Sunday, and we're just, apparently, it's very important to do it now. Apologies. Okay. Righto. Normal foalings, all about being prepared. Foalings don't creep up on you. Sometime 11 months prior to a foaling, you did something quite significant that meant that the mare got mated. So it should come as no surprise that 11 months later, a foal appears. but gestation, that's the pregnancy, is about 340 days, but it can range anywhere from 320 to 360 days. Well, if you told any pregnant humans that their gestation, their pregnancy might alter by 40 days, they'd have a fit. So it's quite normal. On, and you'll have some mares yourself which might even go over a year. Generally speaking, it's nothing to worry about. It's just the mare's own cycle that tells you what to do. But to be prepared, you want to know when the last service date. It's absolutely vital to know when the last service date was. You can then work out when that mare should foal the following year. And I generally work it out about a month prior to the last service date. If she was last covered on the 1st of June, she's going to foal about the 1st of May, there or thereabouts. Now, I've put a point there. I appreciate we invest a lot of money and a lot of emotion into our mares and the pregnancies. We work out which stallion we want to use. We look after them, we feed them. And I've said no excuse to be disorganized. That's not being like a real teacher saying it, but we put such a lot of organization into the first part of the pregnancy. We always want to hit the target at the very end. And for that reason, I like mares to arrive at stud about a month and a half prior to their due date. This is important so that they can get into the management of the stud they're going to foal at, whether you're sending them away or you're foaling them at home. They want to be coming into the foaling box that they're going to be using on about a month beforehand, so they get used to the atmosphere, they're used to the management, used to the changes that they're going to be experiencing. Mares should be well wormed and well vaccinated. The vaccination status of mares is another talk entirely, but should absolutely be tetanus and flu. Rotavirus is optional, EHV is optional as well, but whatever you choose to vaccinate, please make sure it's up to date. And it wants to be a good size foaling box. You can't foal a thoroughbred in an overly small box, and you certainly can't foal a Suffolk in a small shed. It absolutely has to be a stonking great big foaling box, a minimum of 4 by 4 meters, absolute minimum there. And when it comes to foaling, experience is essential. All this effort in the last 12 months comes down to what happens in the last 20 to 30 minutes of pregnancy. So the normal foaling wants to be organized. We want to have a minimal disturbance. We want to have close monitoring, be that on CCTV or a way that we can look at our mares during the night without disturbing them. There wants to be good lighting. You can always find the front or back of a mare, but in the middle of the night when you're trying to find wrap a tail or something similar, you need good lighting for that. It wants to be nice and warm. These foals come out wet. They're going to lose heat very, very quickly if it's a cold and damp evening. A deep straw bed. Don't be tempted to foal them on anything other than straw. Shavings I'm not overly fond of. They get into the foal's eyes and can be quite irritant. And then there's a whole amount of equipment that we could consider. And I've put a picture at the top. It's a fairly old picture. It's got some oxygen there, oxygen here. We've got foaling ropes, we've got some lube, we've got some gloves, and we've got an old-fashioned telephone with a wire on. I put that on because mobile phones don't always work in the middle of the night in some of our more remote areas. And if you need help, you need to have a guaranteed way of communicating with the outside world. We are the UK suppliers of these foaling alarms, the Systec system. You sew in a magnet and a transducer to the either side of the mare's vulva. I'll show you some pictures later, and they go off when the foal comes through the vulva. It's not an excuse for not monitoring them, but it is a little bit of a fail-safe to catch everything up. So that's the list of things that you want to have on standby. And before we get into the big foaling process, just a bit of the terminology. You'll talk about presentation, position, and posture. All those really mean is which way the foal is pointing when it comes out of the mare's reproductive tract, the position of the head with respect to the mare's spine. So is the head flexed or back, and the posture. Where are the legs? Are they flexed? Are they underneath it? Are they extended? Are they coming out? Because most foals come out in the normal way, which is a diving appearance. So they come out with an anterior presentation, the head is pointing backwards, and they come out dorsosacral. So the back of the foal is up against the spine of the mare, and they dive out of the back of the mare. And these pictures on the right hand side, which I hope you can see, show some schematics of how in latter pregnancy the foal changes from lying well in the abdomen with its neck pointing at its back legs, and then it turns and it reaches into the pelvis of the mare to assume the normal diving position for it to come out. And it's an absolute miracle that this happens, and it is so effectively carried out by almost all the foals that we ever deal with. Now, we're going to spend most of our life worrying and talking about foaling, but just do look what an amazing thing goes on. The schematic on the right hand side, which I hope you can see, the pictures are up on my side, but we go from an embryo, we go to a fetus, which is floating around in the uterus, and very rapidly that uterus is filled by placenta, fetal fluids, and a developing foal. And as we get towards the last trimester, the last third of pregnancy, there's not a lot of room in that uterus for anything other than the fetus. It's absolutely incredible how this goes on and how the mare can support it. And it would be amazing if it just did that without any get out clause. But the fact that this then leads into a foaling process, which more often than not ends up in success without any issues and any problems, again, is quite remarkable. And I could talk for ages about the gestation, the development of the fetus inside the mare, without even talking about the foaling process, because it's just incredible. I'll bore you another night with all that stuff. So foalings, we've been told that the mare was due on the 1st of last covered on the 1st of June. She's going to be thinking about foaling on the 1st of May, but we know that there's a 30 to 40 day window that might occur in. So how can we be a little bit more accurate than that? We can't stay up, no sleeping for 40 days. We need to be a bit more accurate. So the normal udder of a late pregnant mare will start to develop and fill about a month prior to foaling. She'll fill during the night and then she'll walk it off during the day. And at some point that filling and walking off will stop and it will just become full. And you end up with teats that start to fill on this picture here. Now, if she's a maiden mare, this udder can take quite a long time to develop, and some mares will actually foal without a bag appearing at all. These little white dots on the end of the teats are called wax, and they are the concentrated secretions that accumulate in the tip of the teat, and it's all to do with how electrolytes change. And on the right hand side, this graph shows what changes in calcium, potassium and sodium occurs in the last few days of pregnancy as the mare matures and gets ready to foal. And it is this crossing over of potassium and sodium and the increase in calcium that results in the wax being produced. Mares will generally foal, it's a very accurate signal, of within 24 to 48 hours of the wax appearing. At the same time, she's preparing her body for foaling, and she'll go a little bit lax around the tail head, the vulva will start to lengthen, and this is all down to a hormone called relaxin being released. That's entirely normal and entirely expected in the late pregnant mare. And I'll come back to the udder again, but I'll mention this a number of times. When your mare is going into the foaling box to foal within the next 24, 48 hours, it's always worth giving the udder a wash with just a little bit of warm water or baby shampoo and drying it. It's amazing how grubby the udder can get. And later in the talk, we'll talk about foals drinking colostrum. You want the first thing that foal suckles to be good quality colostrum and milk. It doesn't want to be bacteria. So just give that a clean before you expect the foaling to occur. I'll show this schematic many times as well. It's an upside down traffic light, no criticism of that, because I think it's really handy for people who are foaling for the first time to know what is normal. So you don't have to write that down. You'll see it again a little later on. But foaling is split into 3 stages. Number 1 is the preparation that the mare will go through. Number 2 is when the foal is delivered. And stage 3 is when the placenta is passed. And stage 1 is technically, it is the build-up of uterine contractions that start to move the fetus around and get the whole uterus thinking about making some big efforts to get the foal out. Now, this can go on for a few days, and it can look very much like colic. She can dig the bed, she can be restless, she can get down, she can roll, she can stretch. She just looks uncomfortable, but it's no surprise. Late-term pregnancy is not meant to be comfortable, unfortunately. And so this is entirely predictable, but it can be difficult for people looking at it to know whether it's colic or whether she's foaling. I put my hand up and exactly as well. I spend a lot of time looking at late pregnant mares, can't tell the difference between whether it's foaling or got colic, because it is very difficult. But generally speaking, stage 1 of parturition of foaling is all about maneuvering the foal inside that mare into the correct position for the next step. What should you do? Well, just keep an eye on her. If she isn't settling, then call out the vet to have a look at her. If all they do is put your mind at rest that everything is okay, that is very, very worthwhile. If she is not colicking and she's proceeding to foaling, and you'll get a feeling for how these mares present, then now is the time to put the tail bandage on and clean the vulva, the perineal area under the tail in preparation for the next stage. And there's a bit of video here. This is the end of stage 1. This is marked by the waters breaking, and this is the chorioallantoic membrane. That's the main part of the placenta, the red part, and it's a large volume of clear yellow fluid. Looks a little bit like urine, but it isn't. It doesn't smell like urine. And just to point out, that little yellow box stitched into that mare is one of these foaling alarms that I was talking about earlier. This mare's rolling, she's looking restless, but straight away we've got some water, and there we are. Now is the time to start your clock, because what happens in the next 20 minutes should be clockwork. So when the waters break, start your clock. At the same time, we need to make sure that this mare is not stitched. If any of your mares are stitched when they're being covered, after they've been covered, or they're caslicked, it will look like this on the left-hand side. It's an operation designed to stop aspiration of contamination and bacteria into the uterus, but that must be undone prior to the mare foaling. So this is your last opportunity to check it. If you know your mare is stitched, I'd recommend opening her 2 to 4 weeks prior to her due date. But now is the time to do it if you haven't already done it. And it's a relatively straightforward thing to do in the comfort of a bit well before foaling. You put some local anesthetic in and you use some sharp scissors, but not point. They're blunt, so you don't make a hole in the rectal wall, and you open and cut it up. If you don't do it and the foal has to come out through a stitched vulva, you'll end up with an injury like this at the bottom, where my hand is going in through the vulva and coming out through the egg, because the foal's feet have gone into the rectum. So stitch must be taken out prior to foaling. And stage 2, the delivery of the foal, is characterized by strong, very strong uterine contractions. But the big thing that gets the foal out of the mare are big abdominal efforts. she'll grunt, she'll hold her breath, and she'll push. And the mare will get up and down. She might move from side to side. And this is getting
Have we lost him?
I think he may have lost signal.
Yeah. I think he's just going to come back in a second.
That's the problem with Yorkshire and their signal.
Just waiting for him to log back in so I can admit him. There he is.
Sorry about that. Was it just me who disappeared?
Yeah.
Sorry. Sorry, Steph, could you allow me to
share? I've
share?
just made you co-host again. You should be able to share now.
Thanks. Okay, are we back again? Apologies. So stage 2, characterized by big abdominal efforts. What you should do at this stage is, if you are feeling brave and you're experienced, put a gloved hand into the mare's vulva and you should be able to feel a nose and 2 feet. If you don't feel confident doing that, please don't do it. But the more you foal, the more you will get experience. And if you can feel a nose and 2 feet, you know that foal is correctly presented. And we are expecting and looking forward to this foal giving birth. So here we have that mare we saw earlier on. She's entering stage 2. She's starting to deliver the foal. You can see 2 feet there, and a foal's nose keeps popping out. This white bag is called the amnion, and it should appear at the vulva, the mare's vulva, within about 5 minutes of the waters breaking. 1 foot is in front of the other, and that's quite common. That's because they tend to squeeze through the pelvis, and the mare will often rest and start again and rest and start again. Again, that's entirely normal because she needs to conserve her energy. The foal will often help, but when she starts to push, she can squeeze that chest through the pelvis, and suddenly out comes the foal, and she'll at that point want to rest. And I would encourage the mares again to just stay down at that point and let the placenta pump the blood from the placenta into the foal. The foal can just have a moment of coming right, and the mare can also just have a bit of a rest as well. So it seems like that has happened in no time at all, but that is stage 2, the delivery of the foal coming out. You saw that amnion over the foal's nose. Please, when you see it, just fold it back so that the foal's nose can breathe when it hits the floor. And stage 3 is the passage of the placenta, or the afterbirth. Now, if you look at the books, you'll be told that the placenta is normally passed within 3 hours, 3 minutes, 30 minutes to 3 hours. If I have any heavies, horses, Suffolks, Shires, anything with feathering, I would be very keen to get that out sooner rather than later, because the longer you leave it in, the more of a risk there is of the mare developing complications of toxic metritis and infection of the uterus. And if any of you have experienced this, you'll know that very quickly these mares can get laminitis and become very, very sick. So I like it to come out as quickly as possible. On the top right corner, there is a placenta that is laid out in an F shape. The bottom of the placenta on the bottom of the screen is the cervix, and then you've got the two uterine horns. If I move you to this picture in the center, the cervix is to the right. The pregnant horn, which is thicker, about 1 centimetre or 2 centimetres thick and very spongy, is to the top. And then we've got the umbilical cord. And then at the bottom where it goes very pink, this is the non-pregnant horn. And it's important to make sure that the whole of the placenta is out. The non-pregnant horn is frequently retained if any part of it is going to be retained. And we'll talk again about this on other occasions, but the very tip of the horn is on the right hand, on the left hand side. Ooh, dear me, there we go. And if you see that little white dot on that picture, this is amazing, because that little white dot is the placenta that was adjacent to the little tube through which the embryo came 11 months ago. And I hope everyone says, wow, that's amazing, because every time I see it, I think, wow, that's amazing. We've got this massive foal on the floor. We've got a uterus that has been dragged through the straw, and yet we can still see the area where that embryo first popped into the uterus. And it is, whilst we're looking at this, you can see all the little dots on the placenta. This is what's kept the fetus alive and the foal alive. And these are the things that can go off very quickly inside the mare if they are retained and cause nasty complications. So please do make sure that that is out. If we summarize the foaling process, normally second stage labor, which is the delivery of the foal, will take about 10 to 15 to 20 minutes. It's okay if it takes 20 to 30 minutes, but if it takes any longer than 30 minutes, then you are in potential trouble. And that means the mare could be in problems or the foal could be compromised. Talk about third stage labor, that's the passage of the placenta. I would change this picture very much for any heavies. And I would say beyond 2 to 3 hours, that placenta wants to be out. If it's still within the mare within 2 to 3 hours, that is an emergency and you want to be on the phone to your vet. Now, that was an entirely normal and carefully controlled and excellent outcome for the foaling. We're now going to talk about foalings when they go wrong and what to do. Now, the one thing you must not do is you panic, and you can never be excused. You've got to go through this. If you encounter a problem, sadly, it's for those who are in attendance to sort out. And we'll start with what is entirely normal for a giraffe, but a little bit irritating if your mare happens to foal standing up. It's pretty common in mares who are very young or unsettled or maiden mares. And what happens is the foal comes out and it gets locked at the hip. Very easily corrected. I say it very easily because what you do is you pick the foal up, you twist it a little bit through about 20 to 45 degrees, and then it should come out much easier. Very much harder when you've got a ton of mare and 60, 80 kilos of foal to do and one other person. But the reason it's quite problematic is it can cause a pressure upon the umbilical cord, which stops the oxygen getting to the foal, and the foal there is hypoxic. It's not getting its first breaths because it can't breathe because it's dangling downhill. Hopefully you won't encounter it because, like I say, most mares who are experienced or committed to the foaling process or are in a normal management situation because they've got used to it will foal lying down. But I don't know if any of you knew, it is entirely normal for a giraffe to stand up. It's quite a distance to fall if you're a baby giraffe, I guess. So the first thing I want to say is about dystocia, about abnormal foalings, is they are always a concern and they're always an emergency, and they often happen in the middle of the night. And I do this talk to vets as well. So this is something that I tell lots of young vets is when the phone goes and somebody says it's a foaling, you get there as soon as possible and you have a very ordered approach. When you are helping and assisting in a foaling, you want to be pulling gently but firmly. You don't want to be writhing, you don't want to be pushing, you want to be pulling when the mare pushes. So when she contracts and pushes, you pull it out. And you remember that the foal's legs were one in front of the other. That means that when you pull, you can pull one leg and then the other leg, and one leg and the other leg, and you start to walk the foal out. And that's because the pinch point is often within the pelvis and at the point of the shoulders. Lubrication, very important. Once the amniotic fluid is gone, you'll need to put some lubrication in to help that foal pass through the placenta, through the pelvis, and get 2 to 3 people maximum pulling. Don't back up your tractor, don't back up the Land Rover, don't do anything. People sometimes like to talk about using carving jacks. I'm not happy. I don't use that because it's so easy to damage the sensitive structures of the cervix, vaginal wall on these mares, which will seriously compromise them for their future fertility. This is what they do in cattle. These are gin sticks to twist and move calves around inside the mare. It has been mooted. This is a useful thing for foaling. Again, I have to say, we can't treat our Suffolks the same as a cow. They just doesn't work like that. But do be well equipped and speak to your vet if you want any more foaling equipment to help you get through the foaling process. So these mares that are not progressing as we would expect, we only know that, and we can only identify that if we are closely monitoring the mare, so we know what is happening and when it's meant to happen. As soon as the waters break, progress should be rapid. Start your clock when the waters break. If you are not seeing progress within 15 to 20 minutes, then there's likely to be a problem. If you feel confident, pop your hand in, feel for a nose and 2 feet. That means that the foal is normally presented and it should progress. But if you're not happy to do that, or there is no progress, or you're just unsure of the situation, don't hesitate, call the vet. If it takes them 20 minutes to get there, half an hour, an hour, it's better that they're on the way and are met with a foal on the floor with the mare nuzzling at it and looking after it like this, than having to deal with something that is dry and then a problem. Some things which go wrong, I want to talk about now. There's a few videos of quite a lot of blood coming up if anybody wanted to leave. One thing you may have heard of is the red bag. This is when the placenta lets go of the lining of the uterus prematurely. And because the placenta is the only contact that foal has with its oxygen supply and its nutritional supply, it's an absolute emergency, because that foal cannot breathe for itself whilst it's in the mare. It either has to get out very quickly and take oxygen for itself, otherwise it will asphyxiate and die, or it will be born with severe compromise and brain damage. It's not something we want to happen. So this picture on the top right shows a placental separation occurring. You can see the white lines just on the outside. It looks like a target. That's the cervix. That is a thick placenta that is protruding. It could, by rights, be the bladder, which is this picture in the center. But let me tell you, I've seen a whole lot more red bag deliveries and only one of these bladders. So the chances are that it's going to be a red bag delivery if the mare is foaling. And the instructions absolutely are: break the membrane and pull out the foal as soon as you can, otherwise we'll be in trouble. And here we have a video of the red bag delivery in action. I'll show you it. This was given to me by one of my clients, and I attended this foaling afterwards. So this mare on the left is going through, she's starting to push. Out comes what you will think she's going to break the waters, but look, it's a big red bag that appears. And if you listen to the audio, you would notice that it goes from being, oh, good girl, to, oh my goodness, what's that? And here's a still on the right hand side. This is the placenta as it is being passed. The foal is within that bag. And watch how much bloody discharge comes out now. This mare's waters had just broken, but that doesn't mean that that foal can still breathe for itself or is getting any oxygen from inside. This placenta is of no help to this foal at all, and that foal has to get out straight away. Unfortunately, I attended this foal, and the foal the mare ended up on the operating table, and we delivered the foal through a cesarean section. And the reason why this was a problem and why the foal didn't make it was because this is how it was presented. It had got its neck all the way back and its legs were all bent. So this foal was never, I'll switch off that, this foal was never going to be able to get out of the mare. And no matter how much pushing the mare did there, it was going to be compromised, and sadly the foal had died. So again, sometimes these things do happen, but even if you are as organized and as rapid as you possibly can be, bad things happen. Dwell on that. I want to run you through a few of the schematics for how things can look when they're inside the mare. And this one at the top is a normal looking foal's position before it is born, diving out of the back of the mare. But we all know that breech presentations occur and foals can come backwards as well. How do you detect whether it is happening like the top or the bottom? Well, at the bottom, you won't be able to feel a nose when you put your hand in. And look at the soles of the feet. The soles are pointing upwards to the tail. On the top picture, the soles are pointing down towards the hocks. If you run your hand up a little further, you'll feel a hock, and a hock and a knee are very different structures to feel. If you put your hand a little further in, you'll feel a tail. If you feel a tail, if you feel a hock, if you see the soles pointing up, you can be fairly convinced that this isn't presented correctly. Again, that you wouldn't wait for 20 minutes to see if any progress would be on. You would call your vet and do your best to get it out. And the reason why these are problematic is because the umbilical cord can get stretched and rupture prematurely, and the foal tries to take a breath and it takes amniotic fluid. So we are born with a very compromised foal in a big predicament. More common dystocias are when the neck is back, or the head is back, or the leg is back. Now this broadens the foal's outline and stops the foal getting through the pelvis as it should normally. The correction is to pull the neck into the pelvis or to pull that leg up into the pelvis step by step. If you do a lot of lambing or calving, you're very capable at this and you've probably got a lot of experience. If you haven't, you will rapidly realize that it is extremely difficult. And foals have got much longer legs than calves and lambs and a much longer neck. So correcting any of these presentations is a lot harder in foals than other species. The one at the bottom is a frequently encountered presentation. It's a foot nape, where the foot is over the top of the foal's head, and that means that the knee is pointing very much uphill, and you can end up with what's called a rectovaginal fistula, a hole between the reproductive tract and the rectum, as top right picture. It's very easily corrected and very easy to feel when you have just popped your hand in to start with. If you get hold of that foot and pull it around the head and reposition it under the chin of the foal, you will stop the damage happening to the mare, as I've shown on that picture. So it's a really easy thing to do, but only easy to correct if you identify it initially. The dog sitter at the top is something that hopefully you only see one or none of them in your life. Everything feels like it's right. You've got 2 feet and a head, but there's no progress. It's because the back feet could be lodged under the pelvis. These are very difficult to correct and often require a general anaesthesia. Now, weird things do occur as well. Twins are very infrequent nowadays because of our excellent ultrasound scanning and picking up problems in the early gestation, which is why it's very important to have your mares scanned 14 to 17 days after cover, and then again for a heartbeat. So there's a set of twins on the top right hand corner. The top one was normal. Sadly, the bottom one was rotten and mummified, and it was compromising the health of the other fetus, and it ended up being aborted. Foals get deformities as well, and this picture at the top was such a monstrous deformity that was passed. And you will sometimes find these at term where things don't go according to plan. You don't understand why the foal is not coming out, but always think that there may be some other reason why it's going to be a problem. And here's that horrible picture of a breech presentation. So when you pop your hand in, this mare would be pushing and pushing and pushing. She wouldn't be having any progress. And you put your hand in, there's no feet, there's no nose, there's just a tail. These are very difficult to correct. I've corrected them on occasion standing up, but more often than not, they go to surgery for general anaesthesia and caesarean section. And it's one thing I would say, please don't be scared of the word caesarean section in the horse. Obviously, it is not ideal, but we are very much better at doing caesarean sections in horses. The recovery rate is so much better, and it will preserve the mare fertility, hopefully for the future, so that we don't damage the cervix, we don't damage her reproductive tract. Unfortunately, because we know that the foal has got such a window of opportunity to get out of the mare, sometimes and more often, sadly, the foal will be unviable or will have died during the process of delivery. But the priority is to preserve the mare for the future. And this goes especially important in horses like the Suffolk, who every mare is important. Obviously, every foal is important, but we need to keep one if we possibly can. So a little summary there again, traffic lights of what those numbers and what when to panic. If you are starting as soon as the waters break, to ring your vet to have them on the way. And a little conclusion here. When it comes to foaling mares and doing it all as well as you possibly can, know what is normal and be very well equipped. Make early decisions if you possibly can. Get to know what you are feeling. Ask for help early. Get people on the way to assist you. And I will tell you that sometimes bad things do happen, but every adult horse that you see will have been a foal at some point, so it can't be that bad. And for all you, that is me at the bottom, trying my very best at one of the Suffolk Spectaculars to look like I knew what I was doing. Wanted to show some evidence. And these are my children, my wife, who race horses, ride ponies, and I just try to keep pulling them out and letting them grow up a little bit older. So that is the first portion of the talk. I'll take some questions on dystocia foalings if you like, or we can rattle through what to do with the newborn foal. Any questions? You can shout out or do a little chat.
Charles, there's only one question I would like to ask, going back to that placenta that you laid out.
Yes.
It didn't look complete. How much And does it split up, and how much can you afford to leave in, or will it cleanse itself in pieces if it doesn't come out completely?
The placenta must come out entirely. You sometimes get little tags that are left in, and the Suffolks are very, very prone, even with just a little bit left in, for it going rotten and getting infected. So it does want to come out in its entirety. That said, when it comes out, the mare will trample around on it or it will get damaged. So it's important to tie it up above the level of the hock so that the weight encourages the placenta to come out. Once it's out, move it out of the way and lay it out and have a look. And you will find holes in it, and they're pretty standard, unfortunately, because of the process. But if you put the edges together, it generally looks like a jigsaw, and you can think, well, you know, that should have come from there and that came from there. So more often than not, you will find that most of the tears marry up with each other, and actually you've got all the placenta. The one bit that you often will leave in are the very tips of the horns, which is why if you turn it inside out, and even if you wanted to fill it up with hose pipe, you'll find it has a cul-de-sac of the horn, and it will suspend, and it will be obvious that you've got a blind ending tube. Does that make sense? And if you've got that on both the left and the right, you've got the whole uterus out. I will talk a little bit later about the foal, and I always encourage mares and foals to be examined the day following pregnancy, parturition, foaling. So always keep your placenta for your vet to have a look at when they come to see your foal.
Thank you, Charles. I think Tam had a question or a chat question. Did you see that?
Shall I read it out?
Yes. Do the waters all break before delivery, or does it break during? When or should I be worried? Should they not break? Generally, the waters will break, and that is the end of the first stage of labour. Once the waters break, you have to go through the next stage, and that seamlessly meshes with the second stage. Sometimes that first and second stage can be a little bit blurry, and the mare is pushing and the waters break and the feet appear straight away. And it can be a bit of a mashup, but waters should break, and the feet and the appear shortly afterwards, within 4 or 5 minutes of the waters breaking. Should I be worried if they have not broken? Well, I would say at that point, you have to be absolutely certain that the mare is foaling. And if she is just lying down and grunting, she may just have colic. The difference between colic and foaling can be difficult to distinguish. And it wouldn't be the first time that a mare has been thought to be foaling and treated like she was foaling when actually she was just colicking. So should you be worried should they not break? Yes, I would be worried if they hadn't broken, because either there is a problem that the foal is not presented and enough force is there to rupture the waters, or the foal has got colic and the mare has got colic, and that should need to be treated at the same time. Does that answer it, Tam?
Yes, thank you.
Brill.
And Sally and Toby Bates have got a question as well.
Yeah. Hi there.
Hi, Charlie. How are you?
You're only down the.
Yes, we're
down the road.
We're day 337, so we're a bit on tenterhooks now. We think we're ready, but we just wanted to run through the foaling kit sort of things you might recommend. I mean, Toby's a bit worried about the lubricants.
We don't know any.
I know, we're a bit scared actually. So
we're getting a little nervous now.
Yeah, we're a bit nervous really. But all is going well so far.
She's doing everything right.
Yeah, so she's bagging up quite nicely, and she's quite loose behind, and her tail is quite soft today. She seems to have some plugs on her teats. So yeah, all's going well, but we just want to make sure we're ready. So we're keeping her at home, but I sort of think we're not tremendously prepared. although we are prepared as we can be. So we have a big barn ready for her to foal in, but we just want to check that if there's anything that we should have, we've got really. I think we'll be ringing for a vet as soon as she goes into starts though.
Yeah, and why not? And why not? If things aren't, if there's any issue, then you want somebody on the way. And if it takes 20 minutes to half an hour, there's nothing better than
do in our location, as you know.
Yeah, true. But if there's nothing better than turning up and everything's fine, and that is by far and away the best outcome. If there is anything that needs doing, don't waste time. Don't wait half an hour and then call somebody.
Yeah. When you're in a rural location like we are, I mean, and you're an hour away, I think you have to sort of make a decision before a problem actually occurs, because of the distance of actually getting a vet to us. Obviously, if you waited 30 minutes, then it's going to be an hour and a half, isn't it? Possibly.
And that's why it's so important to, when the waters break,
if
you just pop your hand in, you don't have to go far. You only want to be up to your wrist in, and you can feel front feet and a little nose, then you know that the foal is well presented and correctly presented. If you feel a tail, you don't feel anything, or then yes, that's the point to ring somebody. Alternatively, if you're foaling down for the first time, as soon as the waters break or you think she's going to foal, get somebody on the way. Better that they turn up with nothing to do than you end up in a pickle.
Yes, that's what I sort of feel, rather than actually sort of getting involved and actually doing more damage than not. But I think I'm hoping she just does it.
Don't
she
we
seems
all?
to know what she's doing, but my goodness.
Oh, Charlie, I'm putting them in watches. When it's close to time, because we've cameraed up the whole barn, I'm going to place them in time slots of when they have to watch their shift.
Crikey.
Yeah, well,
I'm not volunteering. We're not volunteering anybody else here, are we?
They'll do it for a cup of tea and it'll just happen.
Yeah, well, fingers crossed. But yeah, I mean, I think that's something I hadn't actually. I sort of thought that maybe we'd manage it until tonight, and now I'm thinking maybe not. But,
well, it wasn't meant to scare you, but if it just means that as soon as she starts foaling, you ring for somebody to be on the way, I think that's a brilliant outcome. So fingers crossed, hey?
Okay, yes, fingers crossed.
Yeah. Do you want to know what to do with the foal once it's been born?
Yes.
Yeah.
I want to know everything.
Should we go on to that bit? Is that okay? Okay. Righty ho. Here we go. So here we go. A little whistle stop tour. There's only 15 minutes of this. I promise. The neonatal foal, what we're meant to do about it. So when the foal arrives, it's got a huge adaptation to go through. Its breathing has to change. Its heart and circulatory system has to change. The intestinal tracts, the musculoskeletal system, its nervous system, how it maintains its own temperature, how its kidneys function. All of this it has to do for itself. Whereas for the last 11 months, mother has been looking after it with its placenta and its umbilical cord. So it is no surprise that occasionally things go wrong. And it is no surprise in the fetus, in the newborn foal. And here we've got what happens to the heart, the respiration and the temperature within the first 24 hours of being born. The heart, around 80 to 80 when it's born, could be a little bit higher depending on how stressed it is, but it doubles within the first 2 hours, and then it drops back to a steady 60 to 80 beats per minute by 24 hours. It goes from not breathing at all inside the mare to gasping for breath at birth, to then breathing very, very rapidly, one breath a second, for a couple of hours before it settles into a normal foal breathing rate of 1 breath every 2 seconds.
Oops, I think we've lost Charles again. And he's back.
I'm really sorry. BT told us that we could have fibre to our house, but it clearly isn't fibre anymore, is it? Sorry. Here we go. You feel, here we go. So it's absolutely amazing what goes on with these newborn foals and what they have to go through in the first couple of hours of birth. So we've got a newborn foal on the floor. What should it do normally? Well, if you put your finger into its mouth, you'll feel that it has a suck reflex, but it doesn't happen immediately at birth. It takes about 5 to 10 minutes to appear. The foal will then stand. It may take an hour or two to stand. And I'm going to show you lots of videos in the next few slides of how foals stand and what they get up to. But they start to flute their tongue looking for something to suckle. This is a fluting tongue at the top left where they stick the tongue out. It's very, very strong. And they really want to be suckling from the mare within an hour to 3 hours after birth. And that's important so the foal can get colostrum, antibodies, but also so the foal can get energy, hydration, because it's quite a stressful situation it's been through. So here we've got a newborn foal on the right. Mum's back up on her feet, moving around. You can see how so we've seen this bit already, but the foals try to stand up. They're rapidly falling over. It's make an effort, but you can see how huffy and puffy this foal is. It's not had to expand its feet, its lungs until this moment, and it's making a really big musculoskeletal effort to get up and do what it feels nature is telling it to do. But eventually they do get up and they go and have a suckle. So what are we going to do when these mares, when these foals are born? We've talked about the behavioral changes. We need to address the umbilical cord. We need to address the colostrum intake and get that foal on to suck. We need to check the placenta. We spoke a little bit about that earlier. We need to do a few other things too. Meconium, that is the first feces that the foal pass. We'll talk about that in a moment or two. And the tetanus antitoxin antibiotics and blood sample we'll touch on, because that is something that your vet would do at the first visit. The first thing the foal has to do is stand up, and let them do it on their own if they possibly can do. It looks like they can't do it themselves. They've got such long legs, as you can see. They think about it. They get their legs all tied up. They huff and puff. See that respiration? That foal's really working to breathe. It's having a good look around, weighing it all up. And as its neurological system and its musculoskeletal system start to work, you'll find it will eventually be able to stand up and go over to see the mare. Here we've got a foal that's managed to stand up, but see how it stands. It's got its base wide, its legs are miles apart, and it's sort of standing up like a puppet. It's pretty miraculous that it stays standing up. Look at its nostrils. It's breathing quite heavily. It's meant to do that. That's exactly what a normal foal is meant to do. But mum is helping it, and mum is going to push it towards where it needs to have a drink. And these foals are built in with the obsession of needing a drink. So they're going to go to somewhere that is dark, and that's where they know that the udder is going to be. I just mention again, please wash and dry the udder before foaling. Don't do it after, just leave them to it. But if you can do it before they foal, all the better. We want the first mouthful that this foal gets is of rich colostrum, not of bacteria. And this is a foal, it's wobbly, but look at it, its nose is going, it's looking for something that nature has told it is where it needs to be. It's looking in the right area. Mum's giving it a little lick, pushing it in the right direction. The foal can walk. It can get a bit cotted up on the straw, but you can see over the first few minutes that they go from being quite unsteady on their feet to being quite stable. You can still see how this foal is breathing quite rapidly, one breath second, huff, 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 huff. But that, again, entirely normal. And once it starts to get its coordination together, it'll start looking for a place to go and get a drink. And this 3 stills of a foal taking a drink for the first time. You might wonder what this little scar on the mare's udder is. That's where a sarcoid was removed during late pregnancy. Nothing to worry about. But the foal is going for a drink. It goes into the stifle fold. It takes a suck of the hair. It then goes between the back legs and takes a suck there. And then it latches on to the teat with that lovely fluted tongue, and it drinks and takes its first breath. You'll notice that most of these mares that are foaling will have wrapped up. Mare tail, cheese wire on the foal. You don't want the foals to be suckling on dirty, filthy tail. They want to be getting a good drink from a lovely, clean mammary gland like this foal has here. Now, we can convince sheep to stand still and let lambs suckle. We have to rely on the mare to be a bit more tractable. But if you've got a maiden, you might have to be a bit more forceful with the mare to make a stand. But here we've got a picture and a bit of video. Listen, you can hear foal gets on to the suckle. You don't have to have your head between the back legs looking. You can hear it. So not on, not on. There, do you hear? And when it latches on, it's very, very happy, and so it's not there yet, not there yet. There we go. You see it swallowing. So we've got a foal there that you are in your hour after foaling, you know it's drinking because you can hear it, and you can see that its nervous system, its musculoskeletal system are all functioning because it is latched on and doing its thing. This foal, on the other hand, has been born with very tight tendons in its front legs, looks like a praying mantis. And although this mare's a lovely mare, she is helping foal to get onto the suck, and it's suckling very nicely. When I play you a video, you'll see that it's taking such a lot of effort for this foal to stand that the foal's going to get very, very tired quickly. These rather jazzy looking stockings on are splints that I put on this foal to help it, and it did extremely well, no problems at all in the future. But just see how that foal is going to struggle. That foal is going to need a lot more fluid and energy than the average foal because it's putting such a lot more effort into its muscles. But they do extremely well, these foals. The umbilical cord, that's what supplied the foal with nutrients and oxygen whilst it's been in the uterus, but it is a very good way of bacteria getting into a neonatal foal. So it wants to be treated carefully and persistently for a few days. Don't cut it when the foal is born. Let it tear naturally, because by tearing it retracts the blood vessels and stops bleeding. And then I would treat it with either a tetracycline spray, which will desiccate the stump of the umbilicus, or a chlorhexidine dip, or a very weak iodine spray. And the idea is to dry and cauterize the umbilical stump so that bacteria can't get in, because there are only a few ways that bacteria get into the foals. One is through the nose, mouth, and umbilical cord. You need to close all these doors, and because otherwise something like this occurs. There's an ultrasound scan of the umbilicus, and this is an infected umbilicus. This white area, a white circle that appears, is an infected umbilical stump just there, and at the top still is showing an infected umbilical cord stump inside the foal. I like to spray my foals with whatever is your treatment of choice, but for the first few days of birth, until it becomes crispy, until it becomes dry, and then to monitor it over a couple of weeks, because you can get reactivation of the umbilical problems. Colostrum is the first milk that the mare will produce, and it's produced in the last 2 to 3 weeks of pregnancy, and it contains all the immunoglobulins that this foal has. The foal gets no antibodies before it drinks the colostrum, so it's essential that the foal drinks as quickly as it possibly can. If you can get good quality colostrum into your foal, it will mean that it will get less chance of getting disease as it gets older, respiratory or gastrointestinal infections, and that will reduce veterinary costs and hopefully will keep the foal on a really good increasing plane of health. If the foal doesn't get up quickly, it's not going to suckle. If the mare doesn't get up and allow the foal to suckle, it's not going to suckle. So if any of these things occur, take some milk colostrum off the mare and give the foal a bottle. It needs the energy and it needs the colostrum. If you do not have good colostrum, or you miss this window of 24 hours when the antibodies can be absorbed by the foal's intestine, then the only treatment we have available to us is plasma transfusions, which are fearfully expensive. And I say that as a vet. So you want to try and avoid those if you possibly can. So colostrum on the right hand side is that thick, sticky solution liquid. On the left hand side is normal milk. You can see the difference, and you can feel the difference as well when you've got a little bit on your fingers. You can test the quality of the colostrum with a float like this, but what I prefer to do nowadays is use a colostrometer, which is a BRIX, B-R-I-X refractometer. And this is, I think, probably the critical slide of the neonatal foals. Colostrum, because it's so essential, we can test how good that colostrum is. We can supplement it if it is not good enough, and we can collect it in situations where colostrum is very good and give it in a situation where colostrum is not very good. But how do we decide which to take? If you speak to your vet, they'll be able to advise you or get hold of one of these refractometers for you, and you can pop a drop of the colostrum out of the mare's udder onto the refractometer like this, fold the lid over, and then look through the eyepiece, and it will tell you a percentage of sugar concentration, where the blue line and the white line meet. Lorraine Palmer, who's a familiar name to the Suffolk Horse Society, was involved in this work, as was Robert Cash at Rossdale's laboratory, and they produced a table which tells us that where cholesterol bricks percentage was 20 to 30%, it was classed as good. Anything over 30 was very good. So if you have a foal who is drinking 25 to 30% colostrum, you can be fairly convinced that that is going to get maximal immunoglobulins into its system. If the colostrum is less than 15, you're going to have to supplement it. So if you've got a mare who's got great colostrum, you can collect it. And we do that by taking 200 to 350 mils off the non-suckled side of the udder, putting it in a bottle, labeling it and putting it in the deep freeze for use when you encounter a mare who's got poor quality colostrum. You can then frost it slowly, not in the microwave, must be done slowly, otherwise you'll damage the immunoglobulins, and then you can give it to the foal either by suckling or through a bottle or through a stomach tube. And that one effort will reduce the risk of these foals getting ill in their early life. We've been through this before about the placenta. I just want to say it's obviously it's not a neonatal foal, but whilst you're worrying about the foal, please do remember that the mare needs this to be addressed. I just remind you again of the most exciting part of that placenta, that little white dot, but it's more than enough. I've done that twice now, so I shall leave you in peace. And the meconium, this is the first droppings that the foal will pass, and it is a collection of cells and debris that the foal has swallowed when it's been in the uterus through the amniotic fluid. And it's hard and it's waxy and it can be very difficult to pass. Milk or colostrum acts like a laxative and gets the meconium out. But the problem is, if you are a foal who has just been born, and this is a foal that was born on Saturday morning, so it's hot off the press, you can see how heavily it is breathing, you can see how wobbly it is, but it's on its feet and really it wants to be having a drink, but it's got its tail in the air and it's pushing meconium out. If it's pushing meconium out, it's not suckling. So I would always treat my foals when they are born with a fleet enema or a clean enema. Get an enema into the rectum, it encourages the meconium to be passed, and rather than pushing meconium out, you end up with a pile like this on the floor, and the foal then goes and suckles rather than being distracted by the meconium. Look at this foal, bright as the button, huffing and puffing, but it's standing there trying to squeeze out a golf ball of meconium when it really should be drinking. Yes, you can tolerate this for a little while, but it gets a fair bit annoying and frustrating if it goes on for a long time. So always give your foals an enema within 20 minutes, half an hour of being born, so that you can get it on the milk, and then you can go to bed or have a cup of tea. So when the foals are born, they will generally be sitting up in sternal recumbency. That's on their chest within 5 to 10 minutes. That's good. They should have a suckle reflex within the first 10 minutes. They should be on their feet within 1 to 2 hours, and they should be suckling within 2 to 3 hours. Anything that hits the red category there, they're laying flat out on their side for 10, 15 minutes. They don't have a suckle reflex. They don't stand up for a couple of hours. They're not suckling for 4 hours. Those are serious problems. These foals are going to get majorly dehydrated, hypoxic, oxygen starved, and a real problem, and often will end up in intensive care units. So again, it's all about knowing what is normal and knowing when to panic. I would recommend everybody has their foals examined with the first day following birth by their vet, and that's important for an IgG blood test to confirm that enough immunoglobulins have been taken in by the colostrum, because that has a major impact on their future health. I like to give all my foals tetanus antitoxin. they're going to get cuts and scrapes and bruises. It's a very straightforward, easy thing to do. I think it's recommended. And it allows your vet to check the placenta if you've kept it or not given it to anything or put it in the muck heap. Just let the vet have a look, make sure it's out, because like I say, the Suffolks are very prone to getting problems. And I say an emergency. What is an emergency? Well, an emergency is any time the unexpected happen, or you're not happy, or you're not confident with it. And it doesn't matter whether we get there and everything is fine. It means we are there, and we'll always have a good old chat about the good things that are going on in the world, rather than trying to deal with a big problem. And I do know that all these pictures have probably made you all think, well, crikey, how did this happen? But remember, most attended foalings, most foalings that have somebody watching and being there at the birth of the foal, go according to plan. So take home message would be close monitoring of your foals, your mares overnight. Be there for the foalings, know what is normal, look at your newborn foal and treat it as a newborn foal, not just as a bigger horse. And I'm sure 2021 will be highly successful. So thank you all very much for listening, and that's me done.